I'm Kendra Whittemore. I interviewed Fawn Davis. She is a coding specialist at Central Vermont Medical Hospital. After listening to my presentation, I'm hoping that my audience will know how communication technologies, persuasive messages, and presentations are used in healthcare and health information. First, did you know that each alphanumeric code in a medical coding report is basically represents a detailed description of a diagnosis and treatment given to the patient? I didn't know that until I started researching the topic, as well as pursuing a career in the field. I am currently studying for my certificate in health information, which will hopefully lead me to a career in coding or billing in the medical field. I was inspired and became interested in this career by my mother-in-law, who is currently a medical coder. Currently, communication technologies, persuasive messages, and presentations are used in different ways in health information. They are all used to provide employees with ease of information exchange with physicians, offices, hospitals, and also as well as learning opportunities. First, communication technology is used in health information by the use of computers and their specialized software, as well as internet, scanners, and scanners. Medical coders use computers and software such as computer-assisted coding, CAC, which is a tool that converts the notes of a physician in a doctor's report after a physician does a treatment or sees a patient, and records those, then transfers them into medical codes, which then can be represented to like insurance companies for reimbursement. This tool uses the notes in a physician's electronic health record that he keeps of the patient, which is also called an EHR, and provides them the alphanumeric codes for them. Basically, what the coder's job is in using this type of software is to check and fix errors, and then transition it into the place where it's supposed to be going, like an insurance company for reimbursement. Scanners are also a tool used in health information that are used very frequently. They use this tool to communicate with physician offices, hospitals, to exchange documents, exchange reports, and exchange information belonging to a patient. Fawn recommends www.cms.gov as an online resource that she uses very frequently to keep updated with new software and changes within the system. Secondly, we can discuss how persuasive messages are used in coding. According to Fawn, she does not have a lot of ideas of how persuasive messages are actually used in the medical coding field specifically. Basically, medical coding is based all on facts that the physician gives you, and exchanged from there into a medical coding report. Third, now that we have discussed how communication technologies and persuasive messages are used in health information, let's also discuss how presentations are used. Fawn described how presentations are used in a few ways in health information. First, presentations are used when learning the ins and outs of coding. Demonstration on how medical coding and billing works to people learning the field, and helps people to visualize the process of coding as well as the end outcome. This shows people who are learning medical coding and billing basically the ins and outs of how the job works, how the process is being used, how the software and how each tool that is available is being used as a resource in order to complete a job. Second, presentations are used for updating health information specialists in new codes, software, and processes being used. This is important because healthcare is ever changing, and staying updated is part of a coder's job and is expected of all health information specialists. In conclusion, as you can see, Fawn Davis helped me to clarify and educated me in how communication technologies, persuasive messages, and presentations are used in health information, and also how each one is vital and tools that are often used to the process and successful outcomes of the requirements of her job. Thank you.